Good morning. I'm Karen Neely, Chief of Clinical Operations and Innovative Healthcare. Welcome to Start Your Day with Standards. I have with me today Daniel Willey, President of Business Development for Standards. And Daniel, you're with us here today to discuss a really cool, innovative form that Standards has developed to help our physicians, NPs, and physicians' assistants out there to better support their patients getting post-acute home health care and how we deliver home health care to their patients. So Daniel, do you want to walk us through the form?
Absolutely. So one of the most important forms that we work with every day is the face-to-face document. That is a certification that a patient is eligible and ready for home health. So the biggest challenge we get sometimes is CMS has asked that we document in certain ways with certain words that not everyone uses. So what we went through is we built a form that actually allows the doctor or nurse practitioner to come in, fill out for that patient. We give choices of what they're looking for, and it enables us to match that up with an H&P, with a discharge summary, and then get that patient started almost immediately. So the couple things we look at on here is, it's a very simple form, number one. It allows you to check the appropriate boxes for your patient, sign, date, and move on. First of all, we ask for the patient's name, date of birth, and an email address. We should have that for every patient. Referring physician or nurse practitioner. Now, CMS allows all nurse practitioners and PAs to sign face-to-face documentation and continuing orders for patients. So we can accept that from either one, a MD, nurse practitioner, or PA. We also ask for an associate physician if someone else is working with that patient. Traditionally, home health has looked at symptoms, whether it be weakness, falls, pain. After PDGM, CMS no longer allows us to use symptomatic diagnoses, but actually require a true diagnosis. What is leading to those symptoms? Could it be heart failure, COPD, recent procedure that home health is for, aftercare?
And I really like how you've got it with the red, don't use these, green, use these. That's creative.
Absolutely. And allows you just to check the diagnoses that match your patient. Then the area that's always very confusing for people is homebound. What is the homebound status of that patient? So two things that you have to have is a normal inability to leave home, and leaving home must be a considerable taxing effort.
So those are the two things that a physician or NP, PA would need to check all the time.
All the time, they must meet those two criteria. Then there's other options that they can look at that may match that patient. Increased shortness of breath with ambulation greater than 30 feet, physically debilitated, requires frequent rest periods. Those are just a couple. You can check here as many as apply to this patient. And then we look here, we have, what are you ordering home health for? The disciplines that we traditionally use the most in home health: skilled nursing, physical therapy, occupational therapy, and speech therapy. And it really asks, what does this patient need? Do they need teaching for a disease process from skilled nursing? Observation assessment from skilled nursing? Do they need strength training from a physical therapist, or teaching from a speech therapist, or ADL training with an occupational therapist? So whatever applies to that patient, they simply check, and then that will match up with the visit note that they will supply.
So they're basically building the home health episode right there for their patient.
Right there in that patient. So the other thing that's very important is we look at, so this is a supplement to the actual documentation they submit. So a physician's office will also need to submit the most recent visit note, H&P, demographics that go along with that patient. And if it's a hospital patient, then we'll need the demographics and a discharge summary of when they left the hospital. All the physician has to do, by signing this document, they're certifying that this patient is eligible for home health and they have seen them in the required date periods, or that can be signed by, again, an MD, a nurse practitioner, or a PA, and dated.
Well, I have to say, it's very creative. It's like going to some of the fast food stores out there that you get to choose what you want to eat, right?
That's right.
Pretty cool. You get to choose what you want for your patient and getting home health care delivered to them. So thank you very much for stopping by, Daniel, and we commend you on such a great job.
All right. And also, if there's any questions, this can be found on our website, www.standardshomehealth.com, or you can reach out to any of our community development coordinators, and they can actually assist you with any questions on this document.
And we can access on our website?
Absolutely. Absolutely.
And this document, I guess, will be posted on the Standards website also?
Be on the website. It can be emailed, faxed, and posted electronically.
Great. Great job. Thank you.
Thank you.